feel very privileged to chair the Sustainability Grand Rounds. We run these Grand Rounds sometimes monthly, some this year bi-monthly, and we do these to try and increase the volume on the conversation for sustainability at our organisation and try and inspire our colleagues to take some sustainability practices into mind when they practice their clinical work. I'll just start by acknowledging that I'm dialing in from the lands of the Wurundjeri Wurrung people, and I acknowledge that we're all dialing in from somewhere different today. I always like to comment that First Nations people were amazing stewards of our land for such a long time. We really should take advice and guidance from them so that we can do better in our sustainability work. The housekeeping is that I just mentioned to everyone that this meeting is recorded. Please let us know if you've got any concerns about this. This will be displayed on our Sustainability St. Vincent's website for people to look at later on down the track. We'll have two presentations again today in the normal format. We'll call for questions at the end of each presentation. As always, we're always very interested to hear any feedback or suggestions for speakers from our colleagues. Please reach out. Our Sustainability Interest Group email list is slowly growing. We've got a couple of over 460 members currently, so that's an open access interest group. You'll get notifications about this meeting and also our other sustainability events such as the forum coming up. So please join that group or reach out for any instructions on how to do so. Thanks again to Lynn Chong for maintaining and updating that website. Now, we're going to have our two speakers, but we're just going to start with a brief introduction from Carol Beanie, our Sustainability Officer, about an upcoming competition. Is that right, Carol?
Yeah, that's right. Thanks very much, Michael. I'll be super brief. I'll just share some slides to help talk through. Share what I'm going through today. So as you might have seen, last week I shared with the Sustainability Special Interest Group that we've joined the Health Service Environmental Sustainability Competition. This is the competition that Dr. Ben Dunn has presented on a few times at our previous Sustainability Grand Rounds, and it's something that started at Royal Melbourne Hospital and has been really successful in helping them and other health services that have got on board in previous preceding years to catalyse projects to help improve sustainability. So just wanted to give a super brief who, what, where, when, how, but note that I'll share more information with the sustainability group after the official launch next week. So starting off with the why we're taking part, a few reasons. One being that it's a great opportunity to share the sustainability work of staff, both within St Vincent's but also beyond our walls. It's an opportunity to support staff to reduce value care, reduce carbon, reduce waste, help contribute to financial savings, and to help support staff to instigate meaningful changes, impactful changes. How does the competition work? How does it do these things? So a big part of it is by supporting participants to follow a sustainability and quality improvement approach, or SUSQI it's called for short, which is essentially uses quality improvement frameworks, but adds a focus on measuring environmental impacts and social impacts and savings where relevant. So key dates and what's involved from next week when the competition is launched for the next period. Any staff can register project ideas they have, and then they can have access to a whole suite of resources that explain what SUSQI is and provide tools to actually flesh out project ideas. Also get access to colleagues at Uni of Melbourne who are supporting this project and myself to help with projects. You don't need to register, but it is encouraged, so you can access these supports, and including getting the opportunity to go to a SUSQI workshop that Uni of Melbourne is running, which is I think full-day workshop to really get into the details of what SUSQI is and help develop your project that you have in mind. We'll have some drop-in sessions. The key date is the closing date, April next year. This is the out of this whole process is the one date that people who want to be considered for an award need to do. All of the preceding supports, the workshop, the resources, the SUSQI approach, you don't have to make use of those. You don't have to follow those. It's optional. And
Carol, your slides, did you mean to flick through your slides?
It's on key. Is it on key dates?
Nope.
Oh, what's it on?
The first one.
No, we're just looking at, I think it's not in presentation mode yet. We might be seeing your other screen, Carol.
Oh my goodness, I'm so sorry. It's different to what I'm looking at. Okay.
That'll do. That's
How about I just talk and I'll share some slides. Let's step this out. Post. Oh, okay. I can see what you're perhaps looking at now. Yeah, okay. Let's not worry about not looking at that. So yeah, so because it's the first year we're taking part, people can submit projects that have been done previously and still get recognized for those. The who can take part, it can be individuals, teams of people, yeah, final details. As I said, I'll unpack this more in the coming weeks to make it clearer for people, but just wanted to give everyone a heads up. There's prizes in a few different categories across all the health services taking part, and there's 8 public health services taking part for this coming year. So there's categories for best emissions reduction project, best waste reduction project, best clinical sustainability project, one other that's on my slides that I can't remember right now. But there's also a prize for overall winner at St Vincent's Hospital. And yeah, there's a launch next week that anyone is welcome to attend. It's free, it's online or in person at Peter Mac. And I've sent details with the sustainability group if you want to hear more about that. And they'll have a bit of a showcase of the projects that has happened at Royal Melbourne and Peter Mac in previous years to get a taste of the kinds of projects that you could implement here. Okay, so that's me. Sorry for that very clunky presentation, folks. No, thank you for letting me know, Nairi. I was blissfully unaware.
No, you're awesome, Carol. Don't let me put you off.
All right, excellent. It's very good that St Vincent's has taken part of that competition this year, and I know that in the few years that it's been run, it's saved many millions of dollars already and implemented a lot of excellent sustainability projects. So we'll move on to our first speaker, which is Donna. Thank you for joining us, Donna. Donna's a speech pathologist who works at St George's, and as a member of the Health and Independence Program Environmental Sustainability Working Party, implemented multiple initiatives to reduce carbon footprint, reduce waste, and also unnecessary spend. She's going to present today on initiatives and also outline the role of leadership prioritization and local area champions in implementing change, which is a topic we are super excited to hear about. Thanks, Donna.
No worries. Thanks for that intro, Michael. Just checking you can see my slides all okay. Yeah, awesome. I'm also coming from the lands of the Wurundjeri Woi-wurrung people, and thanks for that acknowledgement of country, Michael. So I'll be presenting on the St Vincent's Health Independence Program, or HIP, Environmental Sustainability Working Group, and the initiatives that we've been implementing. The working group is made up of the members that are on the first slide there. HIP is a stream of St Vincent's Hospital Melbourne, and we provide community-based services, both catchment-based and also statewide. Our staff are spread across different campuses within St Vincent's Hospital Melbourne, and I work in the community rehabilitation program based at St George's Hospital in Kew. So I'll start off by telling you a little bit about why we were formed. So in 2024, St Vincent's Health Australia released the 2030 strategy. As you can see on this slide, one of the pillars or priorities was to enhance our impact in environmental sustainability. And this commitment flowed through to St Vincent's Hospital Melbourne strategy in the Environmental Sustainability Action Plan and Policy, and also within HIP locally too, in our strategic planning, and HIP leadership facilitated forming or establishment of our group. And Meg Marmo, one of the HIP managers, is still a member of the group as well. So research evidence tells us that leadership support is one of the key drivers for success in this space. So we're really grateful that we've got that within HIP and at St Vincent's Hospital Melbourne broader as well. Another key driver is governance structures, and we have that at St Vincent's Hospital Melbourne through our Environmental Sustainability Officer in Carol Beanie, the structures to track initiatives, and even forums like this as well. And then a third key driver that we found beneficial for success is staff engagement and leveraging local area champions and local area knowledge. So I'll present on the initiatives that we've been working through with our group. The three that we've been focusing on in 2025 are waste management, paper and postage, and single-use plastics. As mentioned on the slide before, we were set up through leadership support, and they called for expressions of interest, which resulted in a working group made up of passionate individuals with a personal interest in environmental sustainability. And we made sure that we were represented from varied streams within HIP, so we could leverage that local area knowledge. We meet monthly to progress our initiatives, but it is important to acknowledge that the work that we complete in this space goes alongside our clinical and operational roles. So therefore, we make sure we're realistic in our capacity, and we work collaboratively and seek support from appropriate stakeholders as needed. So our first meeting involved discussing ideas for initiatives, as well as ways to involve our team members or engage our team members in sharing their own ideas. We set up a Teams channel and included a spreadsheet to collect ideas from team members. We sent around emails, and we introduced ourselves and our objectives in tier 1 or huddles. That helped us to identify those key priorities that we've been working on. So the first one that I'll look into in a bit more detail is waste management. In my area at St George's, we identified this as a priority because we work off the main campus. At the time, there was no local area guideline for waste disposal, and there was no standard process for commingled recycling, and it was often ending up mixed with general waste. So the first steps we took was reviewing the local waste management processes and engaging with key stakeholders like the manager of environmental services at St George's, my operational manager and team leaders, as well as Carol Beanie and my colleagues as well. So we used that local area knowledge to identify realistic opportunities for implementation and developed a new process that would work. Initially, we brainstormed ideas like putting a 240-litre wheelie bin in the corridor and figured that probably wasn't ideal. So we acquired the necessary receptacles. So this blue bin that you can see there, we've got 2 of those in the corridor. They're a little less bulky than the wheelie bins, which is great. We worked with the environmental services manager and team to include the recycling collection at regular intervals. So that happens twice a week now. We also set up a container deposit scheme bin in our staff kitchen, which a staff member offered to take to her local deposit scheme collection centre, and the money that we collect goes to our social fund. We made sure we had plenty of signage, as you can see in some of these photos, and then we completed education at those huddles again and via email as well, including some specific education that paper towels are not recyclable, and included why that's the case, because the fibres are too short to be recycled. All of this took time. So we started in September 2024, and it finished, the project, I guess, was tied up around Jan 2025. So it took 4 or 5 months to get that in place. Even though it seemed like a fairly simple solution at the time, it did take time to engage everyone and come up with a process that worked for our areas. The second project that we're working on this year, and that's still ongoing, is reducing paper and postage. So the first step in this project was to plan. So we completed a process map of particular processes within our teams, including the high waste area of printing to upload to medical records and printing to fax. So we identified that as a quick win area. We brainstormed ways to audit this. We thought about costings from accounts or orders, but that didn't seem as easy when we talked to our stakeholders, which were the managers. So we decided on a snap audit in key areas where printers weren't shared with other teams. Then stakeholder engagement was the next step, including administration and team members, local managers, and health information services. They're going to provide health information services, that is, they're going to provide training to the team so that all clinical staff that need to upload documents can do so without printing to then send to HIS for scanning, reducing both paper and also saving time for staff. So the training is still pending. That's happening next week. We've done our pre-audit, so tracking the amount of paper and postage, and the training will happen next week, and then we'll do a post-audit. In the implementation phase, we're also considering governance, so making sure that 3 points of ID criteria are still being met with some active checking early on, and then embedding into usual practice with orientation. And then next steps, we're looking at printing behaviour and also reviewing other processes for unnecessary printing too, and continuing to audit to determine the effectiveness of our interventions. And then the third project that we're working on this year is single-use plastics, or reducing single-use plastics. This was another sort of area that staff identified as a quick win, and also an area that I think bothered quite a lot of staff. We had we had slabs of water bottles that were being given to patients when they came in, even though we had access to filtered water or just Melbourne's great tap water. So we used local area knowledge again, identifying key stakeholders, including the operational managers and team leaders, and infection control, as well as engaging Carol Beanie again. The occupational therapy, inpatient occupational therapy department also used the kitchen at Kew, so we engaged them to brainstorm processes or ways that we could not have those slabs of water bottles being delivered, including encouraging patients to bring their own bottle. And then we acquired some cups that could be washed in the dishwasher, and we worked with infection control to make sure those processes were all in place and followed the guidelines. We completed some education at huddles and via email again, and we are still working on a guideline to embed this into standard practice. So it's still ongoing. We started that in January 2025, but it should be finished in the next few months. So some key learnings that we've taken away from our initiatives are the importance of leadership backing and governance within the organisation, as well, as I mentioned in the earlier slides. Identifying and engaging with key stakeholders, really making sure that that's broad as well. So thinking about all the people that might be impacted or might need to be involved in the initiatives. Collaborate or work together, and look for like quick wins, I suppose, even though as I've said, they're not really quick, but easier than some other initiatives that we could look at. Leveraging local area knowledge and having local area champions to make sure that the change is encouraged and sustained, and then embedding it into standard practice as well for that sustainability of change. And then lastly, just persistence, keeping on, and patience as another key learning. So what's next? We're looking at, and I was interested to hear you mention the Carol, the initiative there for, or the competition, I guess. Perhaps this is something we can look at within that competition. We're looking at reducing travel miles, and that's for both outreach staff and for statewide service patients too. So some of our services are statewide services, and patients travel quite a long distance to access our service. So I guess this is a little bit more complicated than the other initiatives that we've tackled already, including how to measure that and how to actually reduce that. So if anyone has any ideas, feel free to let me know or let us know. And yeah, that's the end of my presentation. So thanks so much for having me on the Grand Round today. And yeah.
Thanks, Donna. Super presentation. Beautiful slides. We've got time for a question or two, so I'll ask you to raise your hand if you've got a question. I might just start on it. You didn't. I don't know. I might have missed it, but the time frame that all that activity took place? It's a lot of wins. How long did that take?
So we were formed in maybe September last year. So the
Oh, really?
recycling was started in September, whereas the other two were kind of started December, Jan. So yeah, I say it's a long time, but it feels like a long time when you're in it, but we have done a lot in a short period of time.
You're crushing it. It also seems very linear. I mean, you sort of talk about perhaps a few obstacles, but it sort of seemed a very smooth journey. Can you perhaps tell us an anecdote about at least one obstacle you had to face and perhaps some strategies to overcome them?
Yeah, I mean, yeah, it does seem linear when I talk about it like that, I suppose. I think one obstacle that we're currently facing with our reducing single-use plastics is that at Fairfield, we realised that the dishwasher is actually not plumbed to the hot water, so it's currently not working. So that's on hold at Fairfield at the moment, awaiting engineering to come and take a look at that. Even within the waste management, like I said, the original plan, or when we were working with environmental services, was to have the wheelie bins actually in the corridors, because it made it easier for them to be able to then empty that only very periodically. But that obviously wasn't going to work from a client-facing area perspective. So the hallways are used by clients and by physios to complete therapy. Other obstacles. Meg, you might have an idea there. You've got your hand up as an obstacle that we overcame.
Yeah, I think part of it was we tried to pick things that would have success. We were looking for early wins to establish, a bit of kudos within the group. I actually think one of the features of the success of the group has been applying some of the knowledge and principles and literature around good sustainability. So, we came with some of the ideas that we talked about was potentially having a keep cup approach and looking at servicing the whole team, but the carrot versus the stick and what actually works to influence change. And so we actually chose against tackling that issue as a first principle. We do, we have got a few things around when we have our professional development, we explicitly ask for people to bring their reusable cup rather than using coffee cups and things like that. But it was targeted in aiming to get success early and get some runs on the board to then perhaps go to that next level of complexity and build on those baselines.
Well, I think we're all really impressed in how much you've achieved in basically 6 months. It's amazing. I wonder if you could put that into a package and somehow enter the Susquehanna competition. That's really impressive. Thank you so much for sharing that, Donna.
No problem.
All right, so we might move on to our second speaker, Donna, if you're going to peel off. Now I'm going to turn on to do so. And we're really actually super grateful to have Kylie Feely with us today. Kylie's from Western Health. She's an equipment nurse in the Sunshine Intensive Care. Sunshine, most well known for leadership in sustainability in Victorian healthcare. Kylie completed her bachelor degree in 2000 and then critical care in 2004. She's been a valued employee with Western Health Intensive Care since that time. In 2021, she was appointed the equipment nurse specialist role for the Sunshine ICU. Kylie is the lead of the Sunshine ICU sustainability team, and she's implemented multiple changes aimed at reducing waste, carbon footprint, and money. Kylie tested and rolled out a sustainable linen in Sunshine ICU, something that has now been rolled out organisation-wide. So Kylie's going to present on her work at Western Health, reducing the amount of unopened expired products that are wasted to landfill each year from a quasi-experimental interrupted time series research project. Thank you, Kylie.
Can everyone see my screen? Because I can't see what I'm sharing. So is my talk up on the screen?
Got screen one,
right.
yep. Slide one.
So reducing consumable resource waste. We've already done the acknowledgement of country, so thank you for that. So a bit about us. We are a 13-bed ICU in the Western metropolitan suburbs of Melbourne. So the figures in this talk are based on our 13 ICU beds and with 11 ICU equivalents. And it's also based, I was lucky enough this last year to be awarded the Mac HSR Future Leaders Fellowship for this work. So this is basically the project that I'm 2/3 of the way through. So you're getting a bit of a sneak peek into what I've done. So my project problem, climate change is the biggest healthcare issue now and into the future. Last year, I noticed that every month we alone were collecting at least a box of expired goods. Wasteful, zero value healthcare. It is costly both to the health system and the environment. The photo in this box is worth $350, and it happens throughout Western Health. And it led to the question of how can I tackle this on a large scale? How can we fix the problem? And I was lucky enough to be awarded the Mac HSR Fellowship to do it. So our distribution system, I'll go through it very quickly. I don't think you use Health Services Victoria, Health Share Victoria. I think you purchase your own stuff, but we purchase through HSV. So all of the stock and non-stock items for Western Health come through HSV, and I can't change how that distribution centre works, hence why it's in red. But of what I am focusing on for my fellowship are the sections in green, how much stock is ordered and how it's shelved, and to ensure that it's used before it goes out of date. So to give you an idea of the project overview, I'm doing a quasi-experimental time series study focusing on reducing the amount of expired consumables, and each time series is a month, measured in a month. So all expired stock comes into my office. It's logged for financial cost and weight in grams. And I also note if it's an impressed item or if it's been something bought for a specific patient off the FMIS. Due to budget restraints that hit Victoria just as I was starting this project, we rolled out the first part very quickly, which was the resus trolley stock initiative. So what we said to the wards was, instead of you ordering all of this stuff that goes out of date on your resus trolley, can you please bring it back with 6 months on it? 6 months left to expiry. We'll replace your stock and we will use your stock up. So very simple idea, no cost involved for the wards and not really any cost involved for us because we were already just using the product. So everything's been marked and tracked. So all of the stuff for the resus stock trolley initiative and everything that's come through the ICU expired. I'll go through the interventions in a minute, but basically the evaluation phase, we're just going to keep tracking all the expired stock until the end of December this year. So I'll have a full 18 months worth of data by the end of it. And the project hopes to develop a system that the entirety of Western Health can use, but we will see. So we'll go through the results in a minute, but I just used the first 6 months of data to identify trends that I could then target my interventions on. So what I found was a lot of products were bought for a specific patient, and then after discharge, it's been left on the shelf and bought in bulk too, because you can't just buy one of something, you usually have to buy 5. And so to counteract this, we are starting a virtual stock room with procurement where basically if you've got a box, so for example, wound bottles in our hospital come in a box of 100. You might only need 10. What do you do with the other 90 of them? They sit on your shelf. So procurement and I are working together to get an Excel, it's just a piece on the SharePoint, just to get an Excel document up saying, okay, there's 90 of these bottles sitting in ICU and you can go and get some from ICU, because otherwise the ward buys 100 bottles and they have 100 bottles sitting in there. It's stupid and it's not necessary, but there's no possible way to only buy 1 bottle. So that's one intervention that we're currently working on. We also found that lots of products that were on the catalogue, because I don't know how you're purchasing those, but we scan everything twice a week and there's a whole heap of barcodes in there that require scanning. There's a whole heap that we don't need is the problem, and it takes an awfully long time to go through all these barcodes. So my second intervention was to do a barcode audit and remove as many barcodes as I possibly could that we no longer needed. ICU specific stock, because I'm an equipment nurse, I know all the other equipment nurses throughout the entirety of Victoria and Tasmania. So basically, we're starting up a system where I can ask Carl, for instance, who is your equipment nurse, are you going to use this product? I'm not going to use it. Say I've trialed something, it hasn't worked, or actually the good example is the one that I have sent to Carl over at your ICU, is the sump tubes. So we've changed our nasogastrics from sump tubes, and I had about 50 sump tubes left over. Now they can sit in my ICU going out of date, or I can send them to Carl at St Vincent's and he'll use them. So that's the sort of the system that we're trying to work out between the other equipment nurses. The last one that I really noticed was wound dressings, significant source of waste, and I'll go through some more details in a minute. So we're sourcing some funding to get a vending machine where any random dressings, like hard to come by dressings, are going to sit in the vending machine that wound care are going to look after. Because if I order one for my patient, because I work in an ICU, chances are that patient, by the time the product gets here, has left. And then I'm left with not just one, but I'm left with a box of 5 of a dressing that I don't need. One, it takes 48 hours at least for that dressing to arrive. And 2, what am I going to do with it when that patient's gone? So we're hoping to get funding to set up vending machines, one in ICU, one in Sunshine, one in Footscray, and a couple of other places, the other hospitals as well. So you can just go, all right, I need this weird and wonderful dressing. I'm going to go up and get it from the vending machine rather than order my own. Does that make sense? Yeah. So they're the interventions. I'll show you now. On the screen is some results so far. So this will blow your mind. The total amount of consumables thrown away was 3,000 in this time has been 3,200 items, which is a lot. Unopened, completely perfectly intact items. About 40% of these were non-catalogue items bought for a specific patient. So that's one thing that we're trying really hard not to do. 60% Impress items, which I was surprised, just 60% of over-ordering stuff that we need every day, or do we need it every day? And that's, part of the problem as well. 26% of the items were from code trolleys that were sent back out of date. So hopefully that will slowly reduce as people become more aware of sending it back in time. And then there was about $2,000 worth of wound products. Sorry, just go back to that previous one. I clicked before I meant to. So total weight in grams is 47.5 kilograms worth of consumables that are just going out of date in our 13 beds. So yeah, some of it has gone to medical pantry. Have you heard of medical pantry before? It's where they'll take your unopened, out-of-date products and they'll try and send it to someone who will use it, either a vet clinic or maybe over to Ukraine. But unfortunately, they can't take everything and they're currently full. So everything is on hold at the minute and I'm just accumulating boxes. And if they don't want it, then a lot of the time it just goes in the bin because there's nothing else you can do with it, which is disappointing. But as you can see, it has trended down, which is great. Cost, which will blow your mind, because if it's happening to me, it's happening to everyone. It costs Western Health since July last year, we've wasted $23,800 on products that are just going out of date in the unit. So April seems the first month after the commencement of interventions, and whilst the virtual stock room's not up and running just yet, I do send items to other wards now to make sure that it's going to get used. As you can see, April shows a significant decrease of expired products from about an average of 340 to we only had 4 last month. But it's too early to say whether or not this will stay. We were averaging about $2,750 worth of expired products a month, and I had about $50 last month. But 1 month is not indicative of what can happen in the future. So we'll see. Hopefully the trend continues. So yeah, the interventions, just to put a monetary value on things. There's the resus trolley we saved about $300 worth of stock. In toward transfers, because the virtual stock room's not up and running yet. In the meantime, I just transfer stock myself in between different wards. So, for example, a lot of the resus trolley stock comes back with LMAs in it or eye gels, and they will get used up within the day if I send them over to theatre. So I just walk them around to the equipment nurse in theatre and say, hey, can you use these up today? And they'll use them. So inter-ward transfers have had about $3,000 saved. And then inter-hospital transfers, like the sump tubes, and I think I sent some trackies over to you two as well. We've saved about 3 kilos of waste. I can't really track how much that costs because it doesn't cost me, I'm not saving any money with that, but at least it's getting used. And then the last one was with the barcode audit, we removed 158 items off the ICU Impress scanning list. So there was about 560 items on that list. So we moved about 28% of them, including, interestingly enough, we had 2 types of tracheostomy. We don't need 2 types of tracheostomy. We don't need, so we just went, I spoke to Forbes McGain and said, look, can we just get 1 type? And he goes, yeah, that makes perfect sense. Why do we have 2 types? And the answer is that as we improve things, the old stuff is still on the shelf. We don't necessarily take it away. So it just sits there. So now we've just got 1 type of tracheostomy. Hopefully we'll reduce the cost because you've only got to store 1 site, and we'll reduce things going out of date. But yeah, it's too soon to tell if the interventions will work, but we'll keep monitoring and we'll see how we go. And hopefully we'll be able to introduce the vending machines sometime soon when I get a little bit of money to do it. I'll just show you a couple of other things that we've done over at Western Health, things that you might consider doing at St Vincent's. We introduced reusable linen, both so pinkies, which are the fusion pads that are there, the blueies, so no more disposable blueies, sterile gowns, and reusable isolation gowns. And we saved about 7,200 items a year from landfill just by changing the pinkies and the blueies actually. So we now have completely reusable linen, a significant reduction in usage overall, and there's been no increase in pressure injuries since rollout of the blueies or the pinkies as well. That work is to be published in the coming months. Whoops, sorry. So yeah, that work there'll be 2 papers published from this. The first one's in for review at the minute about the pressure injuries, because a lot of the time people say, oh, disposable is better. It, wicks away the water more. We've proven that's not the case. And the second paper will look at the rollout in terms of carbon emissions, where we're doing the very last work on our LCA for that. Yeah, so that'll hopefully be published in the coming months, and I've been very lucky to have Forbes and our whole sustainability team working on that behind the scenes. The other one is reusable hover mats. So these came out years ago. The first reusable hover mats came out years ago, and people didn't like them because they had to go off to get washed off site. They would take a couple of days to turn around at least, and then they would be back. And so when disposable hover mats came out, everyone went, great, let's get disposable. Unfortunately, what people didn't realise when they did that was that in 12 months, it's going to cost you over $40,000 in cash to use disposable. So, and we created 243 kilograms of waste as well. Oh, my thing's moving on its own. Oh, that's okay, sorry. Let's go back a bit. So yes, so it also produced 243 kilograms of waste. So this is both ICUs now. This is both Footscray and Sunshine, so approximately 20 beds or so. So both units bought 2 reusable hover mats each. We spoke with environmental services, we involved infection prevention, and we found that because we have our own washing machine on site, if we washed to specifications and we dried to specifications, that we would not have to send them back to linen services, and we could, just use them ourselves. And we've saved all this money. So Hasn't been without its problems. Sometimes the mats do go missing for short periods of time. Sometimes they've ended up at Linen Services Australia. In fact, there's actually one sitting in St Vincent's ICU when we transferred a patient to you guys a couple of months ago. But I've air tagged them, so we know exactly where it is. I've just got to get over there to pick it up. By air tagging them, we've sort of kept a really close eye on where they are, because they are, like I said, they're expensive. They cost about $3,500 to buy. But when you think about it, if you can look after it and they last 10 years, that is a lot of money saved and a lot of environmental impact that you've had. So our next project, once we've finished the carbon life cycle of the Blueies and Pinkies, our next project is to work out what the carbon life cycle of the hover mats is, because we'll be looking at cleaning and everything that goes with it, and make sure that they're actually better for the environment. They're cheaper, but yeah. And the key with this one is to involve, like everything, like the same with the linen, is to involve infection prevention really, really early and get them on board first. So that's all my contributors. And any questions? Sorry, that was a lot of information in a very short period of time.
No, that was great, Kylie. Thank you very much. Lovely presentation. Thank you. Carl's on the call, I can see. He's also a gun sustainability champion. Interesting, you're both in the same role. I didn't realise that. I'll call for questions, and Carl, if you want to make a comment as well. I think it's amazing what you've done, Kylie, and really what you've done is you've kind of redesigned a system that is really cumbersome and wasteful, and you've really basically made the system how it should be if it was designed well. It does sound very much, however, as though the system really relies on the linchpin, which is you. So when you finish your work, how do you think you'll translate to the system and then onto other systems?
Yeah, so we're looking, I'm hoping to get, well, I won't be running the vending machines, that will be somebody else. Yeah, procurement are on board, so when I won't be running the behind the scenes of the stock room, the virtual stock room, that'll be procurement. And then I think the barcode audit needs to be done by the individual wards. That's who needs to be looking at their own systems and what's working for them. And I'm more than happy to go around and be a helper with that. I think there's other things that we can definitely do, like a global impress list. I don't know if you've got impress lists for pharmaceuticals. We definitely do, where you can look up, say it's a weekend, you can't get a particular drug, what ward has that drug. I think a organisation-wide impress list for consumables would stop the over-ordering of things. But again, lots of ideas to come out of this.
And now that you've gone through this first part of the journey, if you were going to sort of say to another system, do this bit first, it's the highest yield, what would that be?
I would do your linen, because it depends what linen service you are with. But if you're with Linen Services Australia, this is available now. The Pinkies and the Blueies, so to put in perspective, Sunshine ICU tested them, but they've been rolled out over the entirety of Western Health. So Mariana, who's actually on the call, has done all the LCA for that, which I'm very grateful. So all you have to do for that is, if you have Linen Services Australia as your linen provider, is get in contact with Donna. I would do some serious research with procurement about how much you pay for your linen, and it's very difficult to, it's going to look like it's going to cost you more. All right. There's nothing you can do about, because it's, instead of you owning the product, you rent the product. The product comes in, you use it, it goes back to Linen Australia, gets washed. So although you might pay a slightly higher fee to rent that product, you are not paying to dispose of it. So you're not paying clinical waste. So your clinical waste to the entire hospital system will go down. The hard sell is the way that budgets work for individual wards, because I don't know what it's like at St Vincent's, but individual wards at Western Health don't pay disposal. They don't pay clinical waste. There's no way to tell what waste comes from ICU and what waste comes from somewhere else. So that has its own entire budget. So it looks to the ward like they're paying slightly more because they don't see the cost of disposal. So it's get onto procurement, work out how much you are willing to pay, and deal with linen services. Don't, you know what I mean, haggle a little bit. We have definitely haggled, and we were lucky because we invented, well, I didn't invent them, but we are the ones who were willing to try them, test them, and came up with the ideas to start with. Does that make sense?
Yeah, thanks, Kylie. Carol?
Hi, Kylie. Thank you so much. Some amazing info in there for us to learn from, including, I don't actually have a question. I just wanted to let everyone know that we did recently talk to Linen Services Australia about this exactly, and are talking to procurement at the moment. So really good timing to hear your insights right now. Thank you.
Any updates on that, Carol? How's it looking?
Need to chat to you about it, actually, Michael. And the vending machine idea, is this unique? Is this something that?
I think so. Well, I don't know. It's just something that I came up with about a month and a half ago. That I was like, well, why are we buying so much? So why can't we just put in a vending machine? But it's in its infancy and it needs some serious money to buy the vending machines. So I was hoping to win the grant, but I didn't win a grant for it. So now I just need to try and work out a way. I think there might be some interest from people who own the wound products to give us a vending machine, but we will wait and see. And it's one that I'm actually going to put on, you know, the thing you were talking about from Melbourne University. This is going to be one of the ideas that I submit to that probably next week.
Nari?
Kylie, thank you so much. I'm up in Brisbane, but I work nationally for St Vincent's ESG, and we have a fair bit to do with Renee McBrien down the road at the Children's Hospital. So she would love to hear about what you're doing. This has been a passion for hers. She's a clinician, but she has a regular market day where people come and they see what's about to expire and they swap and they say, oh, we need that, or yeah, and she's just got a whole pile of things that she's been using. But I can't wait to tell her about your vending machine idea. So thank you.
Yeah, well, I heard about people having stock swaps like that. I just wanted to take it one more step further and make it a SharePoint document that people can get access to anytime.
Yeah,
and not necessarily just things that are going out of date, but more things that, I mean, you shouldn't have to buy 100 wound bottles, but you do.
Yeah, and I guess St Vincent's has got a swap meet online SharePoint kind of system where they swap items, but not so much probably bandages. Hey, Carol. Things like that. Anyway, sorry, Andrew's probably bursting.
Oh, Andrew.
Yeah, no, wouldn't say I'm bursting, no, but yeah, no, thanks for the presentation, Kylie. It's great. I look after pharmacy here at St V's, so just sort of on the way through a couple of questions. Yes, we definitely do have a master list of all the drugs that's on the intranet, of all the Impress items, so we definitely do that. And I guess in terms of vending machines, I guess they're perhaps some more, I'm not sure if they're exactly the sort of vending machines you're talking about, but we have been on a bit of a journey over the last, I don't know, 5 years or so, in replacing, because we have very similar challenges to what you're talking about in the medication space. So, you know, wasted medications and expired medications and medications that get ordered that are, you know, for specific patients that get tucked away in some corner that we find out after the event, after they've expired or whatever. So we've been trying to get the money together, and we do slowly, but it'll take a while before we get across the whole hospital to put Omnicell in place. So I don't know if you're familiar with Omnicell, the main competitors, another company called Pyxis, but they're both they do the same thing, and essentially they are very much what you're talking about. They're a big vending machine. They are used primarily to store medications, and they are connected to the PAS system, so you can actually drill down right down to the level of a specific patient getting out of medication at a particular point in time. And if you've got an EMR system, they will link in with the EMR system. So that's where we're hoping to go. We're on the EMR journey at the moment. So when you've got an EMR, that will all link together. And so you'll have very granular information around what medication was used by who, which patient, etc., which we don't have that granularity at the moment. But I know that the Eye and Ear Hospital across the road from us here at St Vincent's, Melbourne, they're probably one of the organisations that have been using Omnicell for the longest, and they have always used them outside of medications, and they've stored a lot of their sort of more expensive medical type equipment, medical theatre, type equipment in the Omnicells as well, for the same reason that you can then, with a much more granular level, manage and monitor what's in the machines, the expiry dates, who's used what, etc., etc. So they are expensive, but I guess if you take a big picture view and a long-term view of it, actually the cost and use of the consumable items you buy tends to drop down quite significantly. So anyway, but great work.
Yeah, that's what I'm hoping to use a lot of my data for, is showing, hey, we've already spent, for example, $2,000 on wound products that have just gone in the bin. So if we were to take that $2,000 and buy something with it that's going to solve the problem, then, but I think Omnicell sounds like a great opportunity.
Yeah, they're good. They're not that cheap though. They're about 60 grand for one unit. So you've got to do your maths. But as I said, if you look at a 10-year, don't think 1 month, but think 10 years, then the equation, and you think about what's expensive versus what's cheap. If you've got areas that are high cost items, and there's a lot of waste, and that's definitely an area worth considering.
All right, well, thank you again, Kylie. Fantastic presentation, and we're always very inspired by the team at Western Health, real leaders in the space in the States. So thank you again.
Yeah, we're very lucky we've got Forbes. It always helps.
Yeah, he's a real pioneer, hey? So, look, I'll draw this grand round to a close. Thanks, everyone, for giving up an hour on your Wednesday afternoon. It's fantastic to see you all. Our next event is actually our Sustainability Forum, which is scheduled for the 22nd of July. Either myself or Carol, I'm sure, will send out some comments about this again. Please register and attend. We really need your support to keep these things going. The next Grand Round event will be the following day, and that'll be our combined Melbourne University St Vincent's Hospital Grand Round. So again, I'll set some comms around that. Please reach out if you want to join the group or have any comments or suggestions. Otherwise, happy Wednesday, everyone.
Thanks, Michael.
Thanks, everyone. Thank you, Michael.
Bye.
Thanks, guys.
Bye.